Hello, class. So now we are on to the cranial nerves. Now, one thing a lot of students get confused with, they think cranial nerves are part of the CNS. They are nerves. So if they are nerves, they are part of the PNS. You only find nerves in the peripheral nervous system. So just some general information about our cranial nerves. We have 12 pairs of cranial nerves. The first two, and you've already seen them multiple times, cranial nerve 1, the olfactory nerve, and cranial nerve 2, the optic nerve, those are associated with the cerebrum. The others, 3 through 12, they are going to be associated with the brainstem. Cranial nerves are designated by Roman numerals, so you need to know your Roman numerals. All the cranial nerves are serving head and neck structures except cranial nerve 10, the vagus nerve. We will be talking about the vagus nerve a lot when we get to the parasympathetic nervous system. And remember your spinal nerves? They carried both sensory and motor fibers. Well, the cranial nerves are a little bit different. Some cranial nerves only carry sensory fibers, some only carry motor fibers, and some carry sensory and motor. And there are 4 cranial nerves, 3, 7, 9, and 10, that also carry parasympathetic fibers. They're part of the autonomic nervous system, the parasympathetic part of the autonomic nervous system. And once you get used to these nerves and look at their names will give you clues to either the structures they serve or their function. So let's get started. So hopefully you have your worksheet in front of you so you can kind of follow along and fill it out as you go along. So this is the diagram you have on your worksheet. So remember, this is the ventral surface of the brain. This is the part of the brain that is face down in the cranial cavity. Just so you know where you are. And this is the frontal, here's the frontal lobes. There's the cerebellum back here, and we are going to be labeling them 1 through 12 in this direction. So, start from the top. This one you already know, cranial nerve number 1, the olfactory nerve. Cranial nerve number 2, the optic nerve. Cranial nerve number 3, oculomotor nerve. Cranial nerve number 4, the trochlear nerve. Cranial nerve number 5, trigeminal nerve. Cranial nerve number 6, abducens nerve. Cranial nerve number 7, facial nerve. Cranial nerve number 8, vestibulocochlear nerve. Cranial nerve number 9, the glossopharyngeal nerve. Cranial nerve number 10, the vagus nerve. Cranial nerve number 11 is the accessory nerve, this strange looking nerve down here. And then cranial nerve number 12, we're going to hop back up here. This is the hypoglossal nerve. So that's just how they are listed real quick and dirty there. So when you're looking at these and you're trying to make sense of them, remember we said some had sensory, some were motor, sensory only, some were motor only, some had sensory and motor. This is the classic way that medical students, anatomy students for years have learned if they're sensory, motor, or both. You just learn this. Some say marry money, but my brother says big brains matter most. sensory, sensory, motor, motor, both, motor, both, sensory, both, motor, motor. So memorize that little saying and you'll know 1 through 12 if they're sensory, motor, or both. And everyone has their way of remembering the cranial nerves, what they start with to help them trigger. Oh, what does it start with? We got our 3 O's right here: olfactory, optic, and ocular motor. So O, O, O. Those are your 3 O's. Then 2, trochlear, teach, trigeminal, anatomy, abducens. 4, facial, very, vestibulo-cochlear, good, glossopharyngeal, vagus, vocations. Always happy, accessory, hypoglossal. So if you want to use this, or if you found another one that works for you, O, 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 to teach anatomy for very good vocations, always happy. That'll work. And the ones with the stars, 3, 7, 9, and 10, these also have parasympathetic fibers carried in them. So let's get started and see which each of these look like. This one you have seen. So remember your cribriform plate of the ethmoid bone had little holes in it? So these are going to be the axons of the olfactory nerve, cranial nerve number 1. They are coming through those little holes and going into your nasal cavity so they can smell those odors, good or bad. And it's going to be picked up on this olfactory bulb, this wide part up here, and it's going to be taken down this tract. And here's the olfactory bulb, olfactory tract right here. So do you remember what lobe interprets olfaction? Do you remember that? It's going to be going to the temporal lobe. So remember, it's the temporal lobe that is your olfaction lobe, your smell lobe. So that's cranial nerve number 1. Cranial nerve number 2, your optic nerve. Some say this is sensory only. It's vision. Here's the optic nerves coming out from behind your eyeballs, and they are going to be crossing over that sella turcica. Remember we did that with pipe cleaners? So this is optic. This is cranial nerve number 2, the optic nerve, and where they cross over, that is called the optic chiasm, the crossing over of the 2 optic nerves. If we did an eyeball dissection, this is the eyeball, this is the optic nerve coming out of it. It's huge, it's pretty big. And when the doctor is looking at you with that light, you know how they're looking in the back of your eye with a light? This is the actual optic nerve that they're seeing right back here, this white space. This is a very, very cool dissection of the optic nerve. Here you can see it coming straight off of the eyeballs, and it's crossing over. Remember, crossing over the sella turcica. And what do you see here? You see these big blood vessels on the lateral side of the sella turcica. What are these big blood vessels right here? You should know this. These are the internal carotid arteries right there. Remember? And your visual cortex, this information is going to be taken back to what lobe is back here? To the occipital lobe. That is your visual cortex. That's where it's going to be interpreting that visual sensory information. So that was cranial nerve 2. Cranial nerve, we're going to group these 3 together because they're all motor. Cranial nerves 3, oculomotor. That is actually telling you I am motor and what am I controlling? Oculo, something to do with the eye. These are all controlling your eyeball muscles. You have 6 eyeball muscles. So cranial nerve number 3, oculomotor, cranial nerve number 4, the trochlear nerve, and cranial nerve number 6, the abducens nerve. All you need to know is 3, 4, and 6 control the 6 eye muscles, your 6 eye muscles. You don't need to know which cranial nerve is controlling which muscle. So where are they? So here's 1, here's 2, here's 3, 4, and 6. So 3 and 6, they're right across from each other on the pons. Here's your pons. 3 and 6, ocular motor. 3 and 6, the ocular motor and abducens. And then here's number 4, the trochlear nerve. So 3, 4, and 6 all control eyeball muscles. They're all motor. The only other thing you need to know is cranial nerve number 3, the oculomotor nerve, also carries parasympathetic fibers that are going to constrict the pupils. So if you shine a light in the eyes, you will see the pupils constrict. So that is from the parasympathetic fibers of cranial nerve number 3. So now let's get to, we're going to go back to number 5. We skipped number 5. Look at this. This is going to be number 5. What do you see on number 5 before I switch the slide? 1, 2, 3. It has 3 branches. It's huge. And it is called the trigeminal nerve. Tri, because it's got 3 branches, and almost any diagram that you see of the cranial nerves, it's going to be huge with 3 branches, like this one. You look at it and you go 1, 2, 3. You know that is trigeminal. This is cranial nerve number 5. It has both. Motor to the muscles of mastication. These are the muscles that when you're chewing food. And it's sensory to the face, nasal and oral cavities, and the upper scalp. So you've been reading the book When the Air Hits the Brain, and one of the attendings does trigeminal neuralgia. He's taking care of patients that have this pain over this area of their face. And the upper scalp here too. It doesn't just stop at where, quote, the face starts. It does this upper part of the scalp. So trigeminal neuralgia is a major clinical disorder. Some people call it tic de la rue. The symptoms are very painful, sharp, electric-like spasms of the muscles in this area. It's very, very painful. So this is showing you the 3 branches and where they go on the face. And this is just showing you going to the muscles of mastication. So trigeminal nerve, huge. It's both motor to the muscles of mastication and sensory. This is all sensory here. So we've already done 6. Remember 3, 4, and 6 were motor to the eyes. So we're going to skip to 7. Cranial nerve 7. Facial nerve. Now, for some reason, a lot of people get the facial nerve mixed up with the trigeminal nerve. maybe because they're both going to the face in some way. But remember, the motor of the trigeminal nerve is to the muscles of mastication. Cranial nerve 7, the facial nerve, is motor to the muscles of facial expression. So always remember, facial nerve, muscles of facial expression. And the sensory is to the anterior 2/3 of the tongue. So you can taste, is it salty, is it sweet, is it sour? That is the sensation coming from your tongue, and it's being picked up by cranial nerve 7. I'm not going to ever ask you any pictures like this, never. I just want to show you these pictures to show you where the nerve is going. Even though when you look at it on here, where are you seeing the facial nerve? You're just seeing this little thing right here that's connected right in between the pons and the medulla. That's all you're seeing. But this is the nerve as it comes out and spreads over the face. So, the major disorder with the facial nerve is Bell's palsy. I mean, this is a classic Bell's palsy. If you tell the patient to close his eyes and smile, this is working. He's closing his eyes and he's able to smile. Remember, part of the muscles of facial expression was this orbicularis oculi, and you were able to close your eyes and wink and then smile. So this side of his face is normal. This facial nerve on this side is intact. This one is not. He can't close his eye and he can't smile. This is Bell's palsy. A lot of people will think they're having a stroke because you get the drooping of the mouth here. But usually it comes on suddenly, and normally it will just disappear in a few weeks to a few months and you'll be back to normal. Don't really know what causes Bell's palsy. Some people think it's a virus, but I don't know if they're really sure. Cranial nerve number 7 also has parasympathetic fibers to the salivary glands. So it's going to the face, and there's a salivary gland right here, so it's kind of on its way anyway to the face. So it's going to go to the salivary glands, and the parasympathetic fibers are going to cause you to salivate, to make saliva. So that's the parasympathetic part. Number 8, cranial nerve number 8, vestibulocochlear nerve. It's sensory only, and it actually is composed of 2 nerves. The vestibular nerve, that's the vestibulo part, that innervates the vestibular system of the inner ear. So here's the inner ear structures. These are the semicircular canals. This is all involved with keeping your balance and equilibrium. You turn your head, you move. These know where you are in 3D. They are keeping you balanced in equilibrium. So that's the vestibular part. And here's the cochlear part. It's going to the cochlea. This is how you hear. So cochlea, hearing, these are both sensory. And they are going, this is showing you cranial nerve number 8. It's right at the intersection of the pons and the medulla right here. And maybe some of you have heard of cochlear implants. They're actually doing implants to help people hear again. So that's kind of cool. And remember, this is all within the petrous portion of the temporal bone, that real thick part of the temporal bone. This is really thick bone up here. So that's cranial nerve number 8. Now number 9. Number 9 is the glossopharyngeal nerve. Glosso means tongue. Pharyngeal has to do with the pharynx. So this is giving, it's both. It has sensory and motor. Sensory to the posterior 1/3 of the tongue, so the back side of the tongue, and motor to the muscles of the pharynx. So this is helping you swallow. So when you're swallowing in the pharynx, you can feel everything moving back there. That is part of the glossopharyngeal, the motor to those muscles of swallowing. And this one, cranial nerve number 9, also has parasympathetic fibers. There's 3 salivary glands. This one is going to the 3rd salivary gland. Here it is right here. You don't need to know which gland it is, but it's another salivary gland. So that's number 9. Now, cranial number 10, the vagus nerve. Now this one, I always say what happens in Vegas does not stay in Vegas. And make sure you spell Vegas like this and not like the city. Vagus actually means the wanderer. This is the only cranial nerve to leave the head and neck structures. Now it is going into the thoracic and abdominal cavities. It is actually giving us sensory from thoracic and abdominal organs, and it's giving us motor to the muscles of the soft palate. So when they're checking your when you say ah at the doctor's office and your soft palate goes up, they are checking the motor of vagus. It's also going to the larynx to help with speech, and to the pharynx to help with swallowing. But the main thing that vagus is known for is its parasympathetic fibers. The vagus nerve is innervating the smooth muscles of the lungs, trachea, cardiac muscles in the thoracic cavity. Then it's going to wander down into the abdominal cavity and innervate parasympathetic fiber innervation to the liver, gallbladder, stomach, all of the small intestines, and part of the large intestines. So huge, huge. This one nerve, the vagus nerve, makes up more than 80% of the parasympathetic part of the autonomic nervous system. And we'll go over this vagus nerve more in depth when we get to the autonomic nervous system. So, 2 more to go. Cranial nerve number 11, accessory nerve, motor only. It used to be called the spino-accessory nerve. That's the way I learned it, because it was partly in the brain structures, the brainstem, and partly in the spinal cord. So I'm not sure why they changed it just to the accessory nerve, but it's a different looking one, so it's easy to pick out. It kind of has all these little, to me it looks like a necklace going around here. So that is an accessory that you wear around your neck, a little necklace, one way to remember it. And where does this guy go? It's motor only. This is going to the sternocleidomastoid and the trapezius muscle. So the accessory nerve. Last one. Hypoglossal, another motor only. Hypo means below the tongue. this is innervating basically the tongue. The tongue is a muscle. So this is the hypoglossal here. So remember I said 6 and 12, 6 and 12. It's way to remember 12 is way up here. Here is the spinal accessory down here. Nothing else looks like it. Hypoglossal. Going underneath the tongue. The tongue is a muscle, so you can stick out your tongue, move your tongue back and forth. That is hypoglossal. So I just wanted to show you, normally in class I do a cranial nerve examination on a student to show you how to do these quickly, and you can do a cranial nerve exam in less than 2 minutes. So I'm going to show you a cranial nerve exam done by a nursing, this is from a nursing school, so she goes over it pretty well. So let me show you this. It's only a few minutes. So she's going to start the cranial nerve exam. Normally they don't do cranial nerve 1, the olfactory nerve. They don't test for it. Usually what we were told to do is just ask a patient, have you had any change in your sense of smell? And that's all you need to do. So here she goes, and hopefully you can follow along and know what cranial nerve she's checking.
So then, moving on with there, I'm going to do an assessment of your cranial nerves. So the first one we would do is cranial nerve number 2, where we would do the Snellen eye chart to test for acuity. And we did do this earlier, and what we found was that in the left eye he was 20/20 here, and then in the right eye he was 20/25. So this is for central visual acuity, that is cranial nerve number 2. And then for peripheral vision, we're going to do this test. Cover one of your eyes. All right, this is called the confrontation test. And tell me when you can see my finger.
Now. 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 Now.
And then switch eyes. Tell me when you can see my finger.
Now. Now. Now.
Last one. Look straight at me.
Now.
Okay, wonderful. So that is cranial nerve number 2. And then moving on to cranial nerves number 3, 4, and 5. Can you take your glasses off for me? And then you're just going to watch this. You keep your head straight and just watch with your eyes. The 6 cardinal positions of gaze. This is testing cranial nerves number 3, 4, and 6, which are in charge of the extraocular eye movement. And I expect his eyes, his pupils to move in a conjugate manner. Follow this in, and then for accommodation, I expect convergence of the axis of the eyes and constriction of the pupils. And then continuing on with cranial nerves number 3, 4, and 6, I'm going to shine a light right into your pupils for the pupillary light reflex. And I see that the pupil constricts when the light is on the pupil. Okay, you can put your glasses back on. And then for cranial nerve number 5, I want you to clench your teeth like this. Show me your teeth. And what I'm feeling here is that I feel the muscles on both sides tense up, because that cranial nerve number 5 innervates those muscles there. And there's a sensory portion to cranial nerve number 5 as well. Close your eyes. Tell me when you feel the wisp of cotton.
Okay. 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 Okay.
All right, so that's cranial nerve number 5, and we already did 6 when we did 3, 4, and 6. So then we're going to go to cranial nerve number 7. Can you smile and frown? And then lift your eyebrows up, and then squint your eyes closed really tight. And just relax. And what I was looking at through that was symmetry of the face. I'm looking for symmetry of the eyebrows, the eyelids, the nasolabial folds, and the corners of the mouth, and it was symmetrical, so cranial nerve number 7 is intact. And then moving on to cranial nerve number 8, I'm going to whisper something. I'd like you to repeat it back to me.
Assessment class. Black shoes.
Okay, so the whisper test went well, and cranial nerve number 8 is intact. Then we're going to move on to cranial nerve number 9 and 10. Can you open your mouth really big and say, ah? And I see that the uvula and the soft palate rose, which is appropriate, and so 9 and 10 are intact. And then cranial nerve number 11. Can you turn your face against my hand? There you go. And again, the other way, press hard. Good, and shrug your shoulders against my hands. Good, and that's cranial nerve number 11. And then cranial nerve number 12. Can you stick your tongue out? All right, you put it back in. The tongue's in the midline, and that's cranial nerve number 12. So that concludes the assessment of mental status and the cranial nerves.
So, quick exam of the cranial nerves. I hope you got something out of that. And now it's on to the autonomic nervous system.